Welcome back. At least 2.7 million Americans are living with atrial fibrillation, an irregular heartbeat which can lead to a stroke. Now, for years, the go-to treatment for preventing a stroke in these patients was a blood thinner, warfarin.
But now researchers say there's something better. Shelley Botat explains in Health Watch.
Stroke is one of the major complications of atrial fibrillation. Now there are new treatment recommendations to protect you from having a stroke. 3 years ago, Donna Marie Robinson was the picture of good health.
I was working out 3 times a week, high intensity.
But then she was diagnosed with atrial fibrillation, AFib for short. That meant she had to slow down.
Oh yeah, I mean, it's a little depressing. It's a little, you don't have control over it.
With AFib, the upper chambers of the heart beat irregularly and don't effectively move blood into the ventricles.
The problem is simply that the blood sits without moving through the heart, and as it sits, it has a tendency to form clots.
If a clot breaks off and lodges into an artery leading to the brain, a stroke happens. For years, the gold standard medicine to prevent a stroke in AFib patients was the blood thinner warfarin. But now, the American Heart Association recommends a class of medicines called non-vitamin K oral anticoagulants. It includes the drugs Eliquis, Pradaxa, Xarelto, and Savesa. With these newer therapies, patients don't need regular blood tests like they do with warfarin. Also, studies show they may be more effective than warfarin and less likely to cause bleeding. Donna Marie takes Eliquis to lower her risk of stroke. So far, so good.
I have a new normal.
Under the new guidelines, patients with AFib who have moderate to severe mitral stenosis or an artificial heart valve should still take warfarin. Talk to your doctor to see if you're a candidate for the newer medicines. And that's your Health Watch. I'm Shelley Botat, Local 5 News.